All right, we're going to start first aid today. I think there's 6 lectures for this, and like I said, these are some long slideshows, and I'm planning on cutting it into bite-sized pieces because my voice will not hold out for 60 slides. It just won't, especially a subject like first aid and life saving that requires a lot of stuff. So there'll be some things that are outdated, such as CPR. I'm not going to teach you CPR. I'm not going to get you qualified to be in basic first aid. It's been a long time since I was a CPR instructor, and frankly, it has changed. It has changed in the last 10 years, to 10, 15 years, 10 or a dozen years. I don't even remember. It used to be, we would do, if you were doing one person CPR, it was 15 compressions to 2 breaths, and now they don't even do breaths anymore. They just do compressions. So it's really it's really very different. I guess they're kind of assuming that as you're doing compressions, the air's going to be exchanging anyway while you're doing that. So, which makes sense. But as we learn, things change, and so that's how that goes. And if there's anything that's updated or whatever, I'll put that out there. But remember, I don't have the study guide up right yet, but it will be up at some point soon. Not that many of you will look at it until the week before the test, anyhow. But we're looking at a course that's going to be probably about 4 or 5 weeks. It's probably going to take us to the end of the school year. So I do want to go ahead and put out some public service announcements for next year. It's going to be exciting. It really is. I am really, really excited. Some of you have been selected to participate in the NJ5 pilot program, or basically it's the NJ Academic and STEM pilot program for this next year, which I think will be a great opportunity. And what you learn and pick up from that, you can pass on to the classes behind you. Teams. I cannot emphasize teams enough. Next year, I mean, stuff is already happening. We're getting approved to go and do stuff again, like go to drill meets and Saturday drill meets. And it's not one of those things you'll be gone every Saturday. You do practice, 3 days a week, but we have these Saturday drill meets that we go to, and it's like a big carnival in a lot of ways because you've got a lot of stuff going on at the same time. And then we'll break for lunch, and it's usually the booster clubs will be doing hot dogs and hamburgers and all that. Mr. Moore is talking about hosting a drill meet here next year. Now that we're getting some first-rate facilities to be able to do that, we're going to be hosting. I'm going to be opening up for rifle tryouts at the beginning of year because right now I have 5 or 6 people. I have 5 or 6 people on my rifle team, but I can't practice them all at the same time. But I will next year because I've got a new classroom, and all of my NS1s will also meet in that classroom as well as my NJ5 class, and I'll have the rifle team set up there. The academic team will be part of the NJ5 team or the NJ5 program. Super exciting stuff. We're going to host a couple of brain brawls, which are academic meets. I'm going to host a couple of rifle meets that even if you're not on the rifle team, we can utilize you to come and help out with that. There's going to be a mess of stuff, a mess of good things that are going to be going on too. Stuff that we can also look forward to doing the following year. Things like Cyber Patriot and JLab. We'll be doing some JLab, but the JLab's going to be more focused for the juniors and the seniors. Well, for the sophomores and the juniors. The seniors can't be part of it, but anyway, that's the JROTC Leadership and Academic Bowl is what that is. So it's basically it's a big old pumped up, jacked up. It's a jacked academic team is what it is. So, all right. We'll determine first aid procedures and apply them as needed. We'll assess first aid situations and demonstrate life-saving skills in emergencies. First aid is the immediate care given to a victim of injury or sudden illness before professional medical help arrives. And anytime you cut your finger, and then you wash it off and then you put a Band-Aid on it, that's first aid. And it can be something as simple as that all the way to somebody having a heart attack and dropping dead right there, and then us administering CPR. CPR is a form of first aid. It's a first response type of thing. The Good Samaritan Law is a law enacted in most states that protects people from lawsuits if medical complications arise after they have administered first aid correctly. First aid correctly. In other words, if I'm uncertified and I do CPR on somebody and they have complications, they can sue me later. So it's not very helpful to them. To determine if evaluate is to determine if an act, process, or method has been attained. Assess, to determine the significance by careful appraisal and study. We'll see what that comes in. I don't know. Consent is approval for what has to be done or proposed by another. We want to get consent from somebody before we put hands on them. The Heimlich maneuver. Anybody remember Heimlich, the big fat caterpillar from Over the Hedge? Is it Over the Hedge? Bug's Life. Thank you. It's a Bug's Life. When he pops out, he's got those underdeveloped wings. He goes, "Look, I am a beautiful butterfly." So, Heimlich maneuver is an upward push to the abdomen given to clear the airway of a person with a complete airway obstruction. Procedure used to expel an object lodged in the airway of a choking victim. All right. Rescue breathing is the act of forcing air into and out of the lungs of a person by another person. All right, 2 to 3 reasons you think people might hesitate to give first aid to strangers in an emergency. That's a question to you all. Yes, Patience. Huh? You can get sued. What else? Lucero. They may not know the person, or they may be startled and afraid to help them. They might be in shock. Jordan. Might be afraid they might do it wrong. Dakari. That they might have an illness. Yep. Might have an illness and you're scared to get it, and you're scared to catch it. So anyway, those are good answers. At some point in your lives, most people encounter at least one situation requiring the use of first aid. It could be when a friend falls and breaks an arm, or your brother cuts himself and requires stitches. Someone should administer first aid until proper medical attention can be given. You could be that someone if you require basic first aid knowledge of do's and don'ts in different emergency situations. And I tell you, when it comes to first aid, it'll happen, especially if you're a corpsman. So I had this one guy I was working on the battle dressing station on the USS Saratoga, and they brought this guy in. And his a tail hook had dropped, and it went right through his helmet. And he's wearing this helmet and these goggles, and it went right through, and the plastic broke, and it cut a big avulsion out of his eyelid. And so his eyelid was like hanging down like this, and you could see his eye through his eyelid. It was pretty gross. So anyway, I administered first aid to that guy and sent him down to medical, and the doc stitched him up. So, all right, I got all kinds of great stories like that though. They just come to me. Oh, I got another one too. While we're being gross, so guy hits his head on an angle iron, and an angle iron is like a piece of steel, structural steel on a ship. And he whacked it, and a lot of times these things are low, and this guy backed into it and like split his head open. It's like a 3-inch cut. 3-inch cut. We could see his skull. It was crazy. So before we could do that, there's this sheathing that covers bone, in particular in this, and it's called the fascia, Fascia. And so we had to actually sew the fascia together. So we had 2 layers of stitches that we had to do. First, we had to sew the fascia together, which the doctor did that, and then he let one of the corpsmen do the final closure of his head, put stitches in. So that's one of the great things about being a corpsman, is if you're operational, you get to do stuff that you can't do in a normal hospital. And I'm telling you, the Army can't do it, the Air Force won't do it, and the Navy will do it any chance we get to go, like put stitches in, sink an IV, any of these things that we can't do back in garrison. In addition to learning the information in this chapter, you should consider taking a first aid class from a school, hospital, or fire department. You'll get hands-on opportunities to practice first aid in simulations and with real people. And I do have some first aid kits that later we can pull out and bandage each other up. And it won't be for this first class. It'll be, but by the time we get towards the end of it, I'll pull out the first aid kits and and I'll show you a few things. So it's kind of fun, mummifying people and that type of thing. Practice is especially important with CPR, cardiopulmonary resuscitation, and mouth-to-mouth resuscitation. Both could be harmful if performed improperly. If you are given rescue breaths and you blow too hard into somebody, you can pop their lung. So there's certain things that we have to do to be very careful with that. So, first aid is defined: the immediate care given to an injured or ill individual to keep him or her alive or stop further damage until the qualified medical treatment can be administered. So you see these guys, these right here, this is called a flash hood. And during firefighting, what they'll do is they'll put that on there, and it protects your head from flash fire that'll jump out at you. So so I've worked in a battle dressing station on the Enterprise as well. In fact, I set the thing up and ran it. But anyway, so we were at general quarters, and it's this teeny little space on the Enterprise. The flight deck battle dressing station was the smallest battle dressing station. There was hardly any room to move or do anything. And so we got all these people jammed in there: stretcher bearers, corpsman, doctor, dentist, chaplain. We got all these people in there. And then we hear this bam, 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 bam. And they pop open the door, and what they did was they threw what we called a flopper in, all right? So this was a training exercise. So they sent this one guy in who, and he had a simulated amputation. So he had this, like what we call moulage put on there, so it looked like he had a stump, you know? And anyway, he drops into the middle of us. I mean, we're all seated on the floor, and he falls on us, and then he starts flopping. And I jumped on the guy, I grabbed his arm, and then I pinched off his radial and ulnar arteries, and then the other corpsman jumps on it, and he throws the dressing on there and ties the thing up. We had the thing dressed in 10 seconds. It was in 10 seconds. And the ship's nurse goes, "That was the fastest tourniquet and dressing I have ever seen." He goes, "That was remarkable." So, floppers, they're always fun. First aid involves caring for people involved in accidents, catastrophes, and natural disasters such as hurricanes, tornadoes, and earthquakes. It also includes dealing with the situation, the person, or the injury. The Good Samaritan law is designed to protect rescuers and to encourage people to assist others in distress by granting the rescuers immunity against lawsuits. Okay. The law protects a rescuer from lawsuits as long as the rescuer acts in good faith, without compensation, and administers the first aid properly. In other words, they have to know what they're doing, and they can't be doing it for payment. They're Good Samaritans. Administering first aid is easier with a first aid kit. It's a good idea to keep one in your house and car. Be sure to take one along on camping trips and hikes. Let me go back to that previous slide. I'm not going to go back up to it because it'll change up the recording. But one of the things I just heard in the news this morning is on a flight from somewhere to Hawaii. I can't remember where the port of departure was, but it was a flight. And anyway, there was a ruckus that was going on, and this lady goes back to find out. There was somebody who said, "Hey, can we get it? Is there anybody medical here in the airplane?" And this lady who was a nurse, she got up, she goes back. This woman had a baby. She didn't know she was pregnant. I'm like, how can you not know? Maybe she's just very heavy, and maybe she's used to missing her cycle. I don't know. But at any rate, she's holding little baby Raymond because he's only 25 weeks old. And here's the funny thing. This nurse was a NICU nurse, as well as two of the friends that she was traveling with. And then on top of that, there was a family practice doc in there too. And they said that when they interviewed the guy, I mean, there's a lot of improvisation that goes into these things. But what they did was they took water bottles and then they would kind of drain them out a little bit and then heat them up in the microwave so that they could form their own little incubator. And they did. And then they also took an Apple Watch. I took an Apple Watch and put it on the baby. Of course, when it's that low, you can put it around their chest, you know. But to be able to monitor the heart rate and the rhythm and all that other stuff, technology is so cool. But anyway, but that's ingenuity. That is that's doing the best with what you got for the situation that's at hand. So a well-stocked first aid kit should contain bandages and band-aids, tape, aspirin substitutes, antiseptic cream, cleanser, safety pins, scissors, tweezers, cotton, tissues. It's not a good idea to keep aspirin, I guess. Aspirin substitutes are okay. Like we like to do Tylenol. For people like in our combat lifesaver bags that we would have, I think I've got one back there, but it doesn't have any meds in it though. But we would keep Mobic in there. Anybody know what Mobic is? Anybody heard of Motrin? Y'all heard of Motrin? Ibuprofen. I know everybody's heard of ibuprofen. All right. I will take ibuprofen every now and then. I try not to take it too frequently because it can cause organ damage with habitual use. But Mobic is like this super heavy duty non-steroidal anti-inflammatory drug. NSAID is what we call them in the trade. And but it's like the super duper painkiller, non-narcotic painkiller. But the thing of it is though, is that it's so powerful though, it can cause other problems with its side effects and stuff. So, but anyway. All right. First aid kits should also have gloves. Rubber gloves keep you from coming into contact with blood and bodily fluids. Oftentimes they're either purple nitrile. Latex gloves are not as good because they found that people have allergies to latex and it makes them itch. That would suck, wouldn't it? Face shields allow you to give mouth-to-mouth resuscitation and CPR without direct contact with the victim. All right? It's got a one-way valve on there. And you take it, you put it over their mouth, and then you'll blow into that. And it's usually got a one-way valve on it so that so that you can blow air in. But like if they puke or something like that, it won't, because sometimes that does happen. If you accidentally blow air into their stomach, if it gets too distended, it'll belch, and then when it does, they'll barf. So you don't want them barfing in your mouth; it'd be gross. When you encounter an injured person, you must evaluate that person to determine what kind of first aid, if any, is needed. This preliminary check follows a series of steps designed to pinpoint and correct the most serious health risks first, then continue with less life-threatening problems. When evaluating a conscious victim, you ask him or her if you can help. Getting consent is what that is, and that's to provide first aid. Hey, are you okay? Can I help you? Get as much information as possible about the situation and how the victim feels. Listen, a victim is the best historian about their illness or their injury. So I tell you, it irritates the daylights out of me. Now you go into a doctor. I'm not saying all doctors are this way. Maybe most of them are not. But when you go into the doctor and then you tell the doctor a few symptoms and then they've automatically jumped to the conclusion as to what the diagnosis is without really hearing you out. So it's very important that you listen to people and find out as much information. What was the mechanism of injury? How did you get hurt? Where does it hurt? Can I take a look at it? Things like that. Because they may have a deformed bone or something like that. They might have a bone jutting through their skin. That's a telltale. That'll tell you something. They may be bleeding. So and we'll get into it as we go, but it's all airway, breathing, circulation. You want to check make sure that they're breathing, or that they've got an airway, so their mouth is open, and you can listen to air moving, then they're breathing. And then C, circulation. And that's when you check their pulse and you make sure that they've got a pulse. Hey, I'll give you a little hint about something. If they're breathing, they got a pulse. Okay. All right, evaluating the victim. When evaluating an unconscious victim, get as much information as possible from any available witnesses to the accident, if they are unconscious. All right, check the victim for a medical alert identification bracelet. That it can give you a clue to any medical conditions that they may have. So, like for instance, you come up upon a person who is, and you'll see this more commonly these days, there's such a high rate of diabetes. All right, you come up on a person and they're unconscious, and you're like, "Hey, buddy, you all right?" And they're like, "Like, hey, wake up!" And they go, "Ugh." And you kind of go down and you listen. You're listening to their breathing, making sure that they're breathing, but then you smell something kind of fruity. They're gassing sugar, is what's happening. Their body's trying to unload sugar as much as possible. And so, if you know, they've probably got a ton of sugar in their urine, but they're gassing the sugar from their blood into their lungs. And you can smell that, and you'll know that a person would be in diabetic coma, and they would need some help. All right, so that's how you would tell if a person is, is you kind of look for the signs and symptoms. And sometimes those people will have a medical alert bracelet that says, "Hey, I'm a diabetic," or "I'm an epileptic," something like that. So have someone at the scene dial 911 for emergency medical service, or EMS as we call it. If you are alone and the victim's condition is life-threatening, give first aid, then call 911. Okay, so and there's certain situations where you would do that. Hopefully there'll be some people around that you can go ahead and start administering first aid, or ask somebody if they know first aid so that they can do it, so that you can call 911, that type of thing. On reaching 911, calmly state the following: your name, location, telephone number, details of what happened, and condition of the victim or victims. A 911 dispatcher will route your call to the appropriate service, the EMS, police, fire departments, all if needed. In most cases, listen, I'm telling you, when it comes down to EMS people, emergency medical services, police, firefighters, ambulance, they're all chomping at the bit to go on a run. They are. They love it, and they'll drive like Johnny Gage to get there. Y'all have no idea who Johnny Gage is, do you? Long time ago, back in the 1970s, there was a show called Emergency, and it was a firehouse. It was a firehouse in Los Angeles, and Johnny Gage was the ride-along paramedic. So they had two trucks. They had the big fire truck, and then they had this paramedic truck. They didn't have an ambulance. They had a paramedic truck that was part of the firefighters. And but anyway, I can't remember the driver's name, but Johnny Gage was the guy who rode shotgun in the truck. If you ever get a chance to watch old episodes of Emergency or Adam 12, anybody here watch MeTV? Few of you. So you'll probably see some commercials for Reed and Malloy on Adam 12. Man, I tell you, when I was in kindergarten, I lived for that show. I would watch that show every time it came on. So, all right. Evaluating the victim. Remain calm, but act quickly. This will reassure the victim and help keep him or her calm too. Do not move an injured person. The exception is when there's a potential danger at the accident site. If you must move him or her, pull by the shoulders in a straight line. This is obviously a person who can't move themselves. If they're laying there and they're all twisted and mangled, the best thing to do is just to leave them twisted and mangled, okay? Unless they're just like in excruciating pain. The problem is, though, is that if you try and move them to try and straighten out their limbs, you can actually cause more injury and possibly kill them. You're like, how can a broken arm kill a guy? And the reason, though, how that can happen would be is if the bone is broken and it's sitting funny, and then you try and straighten it out, and then when you go to straighten out that bone, it nicks an artery. What happens with arteries? They can bleed out. An artery is the steady squirting bright red blood, and it squirts every time your heart beats. So don't move an injured person. If there is more than one victim, evaluate all quickly and help the most seriously injured first. The person who is about to expire on you, the one that's bleeding out, that's the first person you need to take care of, okay? So, yeah, you sit there checking airway, breathing, and circulation, while this guy over here, you see this steadily growing pool of blood. I think I would take care of the guy who's bleeding out first. Right? Take your belt or something like that, and then cinch that thing down, make a tourniquet, proximal to the or medially to the wound. Medially means towards the body, above where they're bleeding. So, and then cinch that thing down until the blood stops. Okay, and then go take care of the airway, breathing, and circulation. That's something we call triage, and it's the process of evaluating who needs help the most. All right, man, that's an old uniform. This is an old uniform. This is 1990s vintage right here. I used to wear one of these uniforms. All right. All right, step 1, check to see if the victim is conscious. Ask, are you okay? And then you tap the victim on the shoulder and watch for a response. If no response, go to step 2. Okay? If the victim is conscious, ask, where are you hurt? And then go to step 3. We'll get to those steps here in just a minute. If the victim is conscious but choking, begin treatment for clearing the airway. Okay? All right, y'all know how to clear the airway? Well, what we do is we do the Heimlich maneuver. It'll come in a later lecture, but the Heimlich maneuver, that's the one where you say, hey, are you okay? And they're like, and you're like, can you breathe? Can you cough? Can I help? All right. And then what you do is you come up behind them and you kind of do your thumb like this, and you put it right here, right where their ribs join into their sternum. You don't want to do it like right at the sternum, just a little bit below that. And then you take your other hand, you put it on right there, and then you go push in and up. And they'll feel like they got punched in the stomach. Because, I mean, basically what you're doing is you're causing the diaphragm, this muscle that's stretched, this thin muscle that's stretched across the bottom of your ribs that causes you to breathe. You're causing it to force an artificial cough, and then they'll cough that thing out. Step 2, check for breathing and heartbeat. Look for rise and fall of the victim's chest. Listen and feel for breathing. Check for a pulse in the victim's neck. Right up here. Right here, this is called the carotid artery. So if you feel the Adam's apple right there, everybody, feel for your Adam's apple. Feel that little bump right there every time you swallow. Right there. You move it over to the side, and then you'll feel this muscle tissue right here. But just in between your thyroid or your Adam's apple and your and this is called the sternocleidomastoid muscle. But right here, you should feel a pulse. You feel a pulse? It's like the strongest pulse in your body right there. Well, it's the strongest pulse you'll feel in the body. The strongest one's actually the femoral artery. I'm not going to demonstrate that one. So, all right. If there is a pulse but no breathing, begin treatment to restore breathing. If there's no pulse, okay. All right, check for bleeding. Look for spurts of blood and blood-soaked clothing. Look for entry and exit wounds. If bleeding is present, begin treatment for stopping the bleeding. And we'll talk about stopping bleeding later on too. Step 4, check for the following signs of shock. This is not type of shock, all right? This is what we call hypovolemic shock, which means that you've had a great loss of fluid in your body. So basically, you're bleeding out. Okay. Some of the examples of that would be sweaty but cool skin, paleness, restlessness or nervousness, thirst, loss of blood, confusion, faster than normal breathing rate, blotchy or bluish skin, vomiting or nausea. Hey, these people are in bad shape. Their skin is like pale, and they've like sweat all over their skin, and they know they're about to die. They feel it. That's why they're restless and nervous. They're thirsty as all get out because their blood volume is decreased. They're dehydrated. All right, well, you can't give them anything to drink. You still can't give them anything to drink. Loss of blood. That's probably it's probably why they're thirsty. Why they're in shock. And then they're confused because they're not getting a whole lot of oxygen diffused to the brain. And then the faster than normal breathing rate, it's like really shallow and faster, like that. All right, it's not deep breathing or anything like that. And then blotchy or bluish skin from lack of oxygen. And then vomiting or nausea. All right, step 5, check for fractures, broken bones. Check for the following signs of neck or back injury: pain or tenderness of the neck or back, wounds of the neck or back, paralysis. Ask the victim if he or she can move. Touch the victim's arms and legs and see if he or she can. All right, continuing our check for fractures. If you suspect a neck or back injury, Immobilize the victim by doing the following. Tell the victim not to move. For suspected back injury, place padding under the natural arch of the lower back. Now, you're not going to take your hand back there and go, raise up, like that, and it's stuff underneath there. You're not going to do that. You'll cause further injury. But what you want to do, though, is if you have other people to help you, you can pad that area. I'm not going to go into it right now, but maybe later. For suspected neck injury, you place padding under the victim's neck and place objects such as rocks or shoes on both sides of the head. Hey, the shoes are great. Shoes and duct tape. I'm not joking. Shoes and duct tape. You take the shoes and you put them on either side of their head, and then bring the heels down to the shoulders, and then and you immobilize them on a board, and then you just tape that thing down. But before you get them but you can't tape them down before you get them on a board. So what has to happen is somebody needs to hold their head so it doesn't flop around. All right. Check for fractures again. Check the victim's arms or legs for fractures or broken bones, which are swelling, discoloration, unusual angle or position of the arm or the leg, bones sticking through the skin, blood. If you suspect a fracture, stop the evaluation and begin treatment for fractures. Check for burns. If you find burns, cover them with a clean, dry cloth. It needs to be clean, okay? Don't pull out your sweaty gym towel and lay it on there. All right? You'll expose them to infection. Check for head injury. Look for the following. Fluid from the ears, nose or mouth, or wounds to the head or face. Slurred speech. As they may have a brain aneurysm or a bleed is putting pressure on their brains. Okay? So slurred speech and confusion, sleepiness, loss of memory or consciousness, staggering when walking, headache, dizziness, vomiting, paralysis, convulsions, or twitching. Okay? If a head injury is suspected, you keep the person awake and watch for shock or breathing distress. You also might want to raise up their upper body if they're not injured, if their torso is not injured. Find a way to gently raise them up so that they're not, so that the gravity kind of takes some of the pressure off the brain. Often calling for professional medical help is the most important thing you can do in an emergency situation. In many communities, calling 911 will connect you to your local police or sheriff's department for help. Follow these steps. Calling for help. Speak slowly and clearly. Identify yourself and the phone number from which you are calling. Give exact location of the accident, including town, street name, and number. Describe the building if it's at night. Describe what's happened. Give essential details about the victims, situation, and any treatments you've given. Let the person on the other end ask you questions and tell you what to do until help arrives. This one is key. This is key right here. Because are you going to remember all of these other things? No, you're not. You're going to be your brain's going to be going a mile a minute. You're going to be nervous and scared, and if you're trying to volunteer information, you're going to talk too fast. So calm down and let the operator ask you the questions. Don't hang up first. The technician will probably have more questions and may ask you to stay on the line until help arrives. You should call for an ambulance or emergency assistance if the victim is or becomes unconscious, has trouble breathing, has persistent chest or pain pressure, is vomiting, has seizures, slurred speech, or persistent severe headache, appears to have been poisoned, has injuries to the head, neck, or back, or has possible broken bones. You should also call if there is a fire explosion, a downed electrical wire, swiftly moving or rapidly rising water, poisonous gas present, a vehicle collision. All right, during an emergency situation, we use the ABC steps. A stands for airway. Is the victim's airway blocked? If so, we clear the airway. B, we check for breathing. Is the victim breathing? If not, we restore breathing. We do that through rescue breaths. Circulation. Is the victim's heart beating? If not, we restore the heartbeat. And we do that by CPR. Choking. All right, choking occurs when a person inhales something into the airway, leading to the lungs, blocking off the airway and preventing breathing. If completely blocked, he or she will be unable to make any sounds because no air is getting to the vocal cords. But if the person can speak or cough, you should try to let him or her clear the airway on their own. So that's why we'll ask them, hey, can you breathe? Can you cough? If they can cough, then they can clear their own airway, which is really helpful. If the person can make no sound and indicates choking by grabbing the throat, the best method for clearing the airway is the Heimlich maneuver. All right, so we stand behind the victim and wrap your arms around the victim's waist. You make a fist with one hand, place the thumb side of the fist against the victim's abdomen slightly above the navel, the belly button, well below the breastbone. Grasp the fist with the other hand. Give 6 to 10 quick backward and upward thrusts, repeating until the airway is clear. Don't slap the victim's back, which could make matters worse. For exceptionally overweight victims or pregnant women, use the same procedure except place the fist in the middle of the breastbone. So the breastbone or the sternum, you would put it in there. So, if you are alone and choking, you can perform the maneuver on yourself. Lean forward over a railing, sink, or the back of a chair and thrust yourself down until you dislodge the obstruction. Just depends, I guess, on how desperate you are. You can throw your body on there, crack a bunch of ribs. Yeah. Can you imagine? That sounds like something out of a movie, doesn't it? You can just see it. I mean, you can just imagine somebody just like going, whoa! Huh? Death by chair. Well, hopefully, trying to get yourself to be able to breathe. All right. Verify that the victim is both unconscious and has an obstructed airway. Then, with the victim lying on his back, you kneel astride the victim's thighs. All right. Place the heel in one hand against the victim's abdomen and between their belly button and the breastbone. All right. Slightly above the navel, but well below the breastbone, with your fingers pointed toward the victim's head. You take your hands, you put them like that, and you go boom, boom, boom. So you're going to push down and up against the into the person's abdomen. Of course, they're laying on their back. Verify. Place your other hand on top of your first hand and press into the abdomen with a quick forward and upward thrust. You repeat this 6 to 10 times. Okay. Open the victim's mouth and sweep out any foreign matter using a hooked finger. Be careful not to push anything down the throat. All right, so this procedure is different for an obese individual or a pregnant woman. Okay? So we're not going to be able to do this on an obese person or on a pregnant person because obviously their stomach's too big. So you'll have to use the breastbone in that case, which can be dangerous. It just can, but it's better than dying. You got to do something, right? So, but with this, when you do the finger sweep, you open up the mouth and you see if you can see anything, and if you do, then you dig your finger in there and pull that thing out. It's all right. It's better than them dying. You can wash your hands. They can't come back to life. All right. Clearing the airway of an obese or pregnant unconscious victim. Kneel to the side of the victim's body. Locate the lower edge of the victim's ribs, and run the fingers up along the rib cage to the notch where the ribs meet the breastbone. All right. You got to be real careful. There's this little thing right down here. It's a little tab of bone. It's called the xiphoid process. So you got to get up a little. You got to get above that. If you get down on it, you're going to snap that thing off and drive it into their liver, and they'll bleed to death internally. Okay. Place. Huh?
That was a nice way to say it.
Oh, what, the bleed internally? Yeah. I mean, it's terrible. It's a terrible way to go. All right. Place the heel of the hand 2 finger widths above the notch. 2 finger widths above the notch. Place the other hand over the first. All right. And then interlock the fingers. Position your shoulders over your hands with your elbows locked. Press down 1.5 to 2 inches, 6 to 10 times. All right. If they still got a pulse, it's not going to change anything. It's not. So it's just but you're probably going to hear some bones. You're probably going to hear some ribs cracking, as in like separating. So open the victim's mouth and sweep out any foreign matter using a hooked finger. Careful not to push it down the throat. If you discover a victim who is not breathing, it is necessary to start breathing for the victim by forcing oxygen into his or her lungs as soon as possible. This is called rescue breathing or mouth-to-mouth resuscitation. It's important in preventing brain damage and death. Okay? What will happen if you don't get oxygen to your brain within about 10 minutes? Actually, within 10 minutes, your brain will begin dying. All right. So, and that's why like when people choke, it takes a long time. It takes a long time for them to they actually have a long time to die because the brain's still going, but it's dying even though they're not breathing or their heart's not beating. Okay. All right. The following steps should be followed to administer rescue breathing to adults. Procedures that are different for infants and small children, and those procedures will follow. Okay. Roll the victim gently over if he or she is not already facing up. Using a hooked finger, sweep out anything in the mouth, being careful not to push anything down the throat. Tilt the victim's head back sharply by pressing down on the forehead and lifting up on the jaw. This straightens the passageway to the victim's lungs. Keeping the victim's head back, pinch the nose closed. Then cover the victim's mouth with your mouth and give 2 full breaths lasting 1 to 1.5 seconds. Pause between breaths to let the air come out of the victim and to breathe in yourself. The other thing is too though is that when you want to gently blow in, all right, and then once you see their chest rise, then you stop breathing, you stop forcing their air in there. Otherwise, what will happen is you'll overpressurize the lungs and you'll pop them. So, if the victim's chest does not rise when you breathe into the lungs, reposition the head slightly and further back and repeat the breaths. Hey, listen, don't try. If you feel resistance, don't try to force air in there anyway, because what you'll end up doing is forcing air into their stomach. Yep. If the victim's chest still does not rise after the above step, perform abdominal thrusts to clear the airway, then repeat breaths. After the 2 breaths, listen and feel for breathing by placing your cheek close to the victim's mouth. At the same time, check the victim's pulse by placing 2 fingers in the groove of the neck and on the carotid artery next to the Adam's apple. If there's no pulse, you start CPR immediately. If there is a pulse but no breathing, continue breathing at the rate of 1 breath every 5 seconds. Okay, so every 5 seconds, you take 1, 2, 3, 4, 5. So where you go 1 1,000, 2 1,000, 3 1,000, 4 1,000, that kind of thing. If the victim starts, stop the rescue breathing and let victim breathe on his or her own. Check for and treat other injuries. Observe the victim closely until medical help arrives. All right, then you want it to, well, this is children and infants, but if the victim starts to breathe on their own, roll them over on their side. You roll them over on their side, and then you take the top leg, and then you kind of bend it, and then lay it over. So that way that they're kind of slumping. But you take so if they're laying on their right side, you'll curl their left leg up, and then it'll rest on the floor, and then you'll take their hand and you'll put it on the floor, their left hand, put it on the floor. So it kind of props them up a little bit, and it allows them to breathe on their own. All right, for young children and infants, you roll the victim gently over if he or she is not already facing up. Using a hooked finger, sweep out anything in the mouth, being careful not to push anything down the throat. Instead of tilting the head back, place a finger under the chin and lift it slightly. This straightens the passageway to the victim's lungs. All right, keeping the victim's head back. Instead of pinching the nose closed, cover both the mouth and the nose with your mouth and give small, slow, gentle breaths, each lasting 1 to 1.5 seconds. Pause between breaths to let the air come out of the victim and to breathe in yourself. Okay? So it ain't going to require much air. All right, it's not going to, they get teeny little lungs, teeny lungs. And as you cover their mouth and their nose, you just blow until you see their chest move. That's it. And then you stop. All right, if the victim's chest does not rise when you breathe into the lungs, reposition the head slightly and further back and repeat the breaths. If the victim's chest still does not rise after the above step, perform abdominal thrusts to clear the airway. Then repeat the breaths. After the 2 breaths, listen and feel for breathing by placing your cheek close to the victim's mouth. At the same time, check the victim's pulse by placing 2 fingers in the groove of the neck and on the carotid artery next to the Adam's apple. If there's no pulse, start CPR immediately. If there is a pulse but no breathing, continue rescue breathing at the rate of 1 slow breath every 3 seconds. If the victim starts breathing, stop the rescue breathing and let the victim breathe on his or her own. Check for and treat other injuries. Observe the victim closely until medical help arrives. Almost there, y'all. Name the differences and procedures for rescue breathing with children versus adults. Tell me a couple differences. Yes, Jordan. Say again, please.
You can't use as much
That's right. You can't use as much breath for children as you do adults. Daniel.
Instead of pinching the nose, you have to put your mouth over the nose and the mouth.
That's correct. Instead of pinching the nose, you have to cover their nose and their mouth with your lips. Yes.
You don't tilt their head as far back.
What's that?
You don't tilt their head as far back.
You don't tilt their head as far back. That's very true. Very good. All right. This concludes this lecture. Y'all want to say, add some applause to the Yay! It's over. Hey, while I will go ahead before I'm going to stop the recording. One of the things I am going to tell you guys though is that this this stuff that I've been teaching you, you're not going to be qualified to do this stuff after watching this lecture. I got to make sure you understand that. You may have a knowledge of it, but at this point you're dangerous. So don't attempt anything like this. All right. So if somebody's having somebody here in the hallway has breathing, respiratory, or cardiac arrest, you can still check to see, and you can even do a rescue breath or two. It'd be fine too. But you need. Okay, no, you're good. I'm sorry. And you can even do a rescue breath or two, but you need to get some help right away. So come and get a teacher, and we'll get that taken care of. All right.